Hmm. Difficult question. Okay, so I think it is. We do know that the general population, there is body dysmorphia within the general population, but actually research shows of the clientele who come to plastic surgery clinics, the proportion of patients with body dysmorphia is much, much higher than the general population, sometimes often 4 to 5 times higher in that particular group. And I think really it's the duty of the surgeon and the doctor when patients come along and when they're doing the assessment to choose and advise the patients correctly that, okay, if this is a reconstructive or corrective procedure, trying to put things that were right before, trying to put things right now, the outcome is likely to be good. But if it's purely a change of appearance because somebody is unhappy with that appearance, or they think by doing this operation it may have a positive effect on their social life, on their work, or on their interaction with their colleagues, these are the kind of patients that you may have to steer them away from surgery, at least initially. So that what I always do, if I feel somebody who has unrealistic expectations, or I think they may need some psychological support, I always refer them to one of my colleagues who's a specialist in cosmetic psychology. They have a discussion, and then she'll write to me and say, well, actually, I think, okay, if this patient has this particular operation, they'll have likely to be happy with the outcome. But sometimes some patients, she will tell me that they may not be happy with the outcome, and they're the ones that shouldn't have the surgery because it's the wrong thing for them to do. And I feel strongly about this, to be honest with you, because there are many, many vulnerable men and women out there who don't get a proper consultation, don't get a real fair, review. Whereas by just directing patients in the correct channel, you can avoid surgery. I do reject a fair number of patients in my clinic for surgery because I just know that surgery is not the right thing, and you could do the most amazing operation, but if the patient is not going to see that change, then you're just never going to win.